Hi, everybody. Welcome to Core Initiative Billing Services LLC. Procedure codes beginning with 99 are usually EM codes, and they require a modifier 25 if there are additional procedures performed during the visit. Here are some examples. Those are your procedure codes, and these are your diagnoses. If the main reason for the patient's visit was for a rash, for example, and they were experiencing palpitations, you would make sure to link the diagnosis code with the appropriate procedure code. So the rash is going to go to the EM and the palpitations will go to the EKG. And that is what your procedure codes with diagnoses linked to them are going to look like before you send it out for billing. And this rule is pretty standard and it applies to almost all scenarios. Certain screening services or tests require modifiers. Here are some examples. Breathing tests, developmental or psychiatric screenings, biopsies, or wound repair. We're going to go over a couple of examples so that you can better understand the types of procedures that require modifiers. Here are some examples of a few procedures that would typically require modifiers on them. Mohs micrographic surgery. I'm sure you've all heard of this. This is pretty popular. You would typically report the surgery codes with a modifier 59. So skin biopsies, pathology, frozen section pathology, and frozen tissue would require a 59 modifier, depending on what other procedures were performed. Breast biopsies is another procedure that often requires modifiers. You would typically report breast biopsies with a modifier 50 because it's typically done bilaterally. Here are some examples of procedure codes that require a 50 modifier. Diagnostic Radiology. Now, following specific guidelines, you should be appending a modifier 59 on these procedures, and here are some examples. Telemedicine has become huge in the medical field, especially with the pandemic. A lot of patients were afraid to leave their homes, or offices were closed and couldn't accommodate all of the patients that they needed to see. So telemedicine has become very helpful to providers. Knowing how to bill them, though, is a big deal. Appending the correct modifier depending on the insurance company is very, very important. So here are a couple of modifiers that you would be appending to your EM to indicate that it is a telemedicine. We have a GT modifier, 93, and 95. So the 93 is somewhat new. We can go over that in the next show, or you can reach out to us to talk more about the 93 modifier. But a 95 modifier is the most popular, typically because it's used by Medicare and Medicaid policies. So you will see a lot of 95 modifiers being appended to telemedicine visits. And knowing how to correctly append will get your claims paid quickly without denial. Developmental and behavioral screening often require modifiers as well. 96110, 96112, and 96160. All of them get appended with a 59 modifier, especially if multiple procedures are performed during the visit. So if a patient came in for a well visit and behavioral screenings were done, you're going to want to append with a 59 modifier to make sure that it doesn't get bundled with your well visit. And that's all, folks. For more details on how to use specific modifiers, please feel free to reach out to us at 516-308-2687. I hope this video was helpful to you. Thank you for watching.